Thank you all for joining us today. I'm Jen Harris with Montgomery County. And if you have any questions as we go through the update, please feel free to ask those using the chat or the Q&A. And as soon as Dr. Bissell is finished giving us her update today, we'll be able to address those in the order in which we received them. Thanks again for being here.
Okay, thank you so much, Jen. Good afternoon, everybody. Here we are, Thanksgiving week. I wanted to just give a quick update. So new cases of COVID-19 in the New River Health District have essentially plateaued. Same thing has happened statewide. We do expect that we will see cases rise after Thanksgiving and our winter holiday gatherings because more people spend more time indoors. But we don't expect numbers like we had last winter or with the Delta surge. Nationally, we have seen cases start to rise again because states to the north and states out west are currently seeing their Delta surges. Delta is very highly transmissible, and there really is no avoiding it. Surges are occurring in communities that have had the most stringent restrictions and precautions and lockdowns, and they're also occurring in communities that have some of the highest vaccination rates. So Delta is here. We do have our epi curves. I think Jen can put those up for us and we'll go through those. So as always, district-wide, you can see that we sort of have plateaued the last couple of weeks, and we do expect that the week of the 16th that those numbers will kind of fill in a little bit more. And if you move through, we have Montgomery County, the same thing. What was a slow decline seems to be, even slower or even a plateau. We do expect that last bar to fill in. Bradford City, very similar. And just moving on through Floyd County, again, look at the numbers on the y-axis. You're talking 20 to 30 cases in a week. So it's going to vary a little bit more or look like a more significant variation, but it's essentially plateaued around the 20 mark. Next, we have, I think, Giles. And again, kind of very similar there. And then Pulaski. Same thing, kind of leveling off there, not really dropping anymore. And then our school-age children have come down from their peaks as well, but not unlike our community, they too have plateaued right around 20, 30 cases a week, and that's district-wide. And then you can see our college students, again, very small percentage. Overwhelmingly, it's our community cases. Okay, so I will note that we are seeing a large number of influenza A, the H3N2 variant locally, particularly amongst our university students. Flu A does tend to be more severe, and many of our college students have felt worse with the flu than they did with COVID. Those who are young and healthy often have very minimally to asymptomatic cases of COVID. So we do want to remind both patients and providers to be thinking about flu. This is a relatively early flu season when considering symptoms, as they can overlap and be very similar to COVID symptoms. So you should get tested for flu in addition to COVID. That's a good idea. And symptoms should not be presumed to be COVID without testing for COVID and for flu, just to separate those two so that we can kind of clarify what the true symptoms are, what the true cause of the symptoms are. And people can have COVID, they can have flu, or they can have COVID and flu. We've known since the beginning of the pandemic that the number of cases is definitely higher than those that we've documented. And our data shows us the estimates are that ratio is between 3 to 4 to 1. So for every one case we've documented, we've probably had 3 or 4 other ones. Serology studies, which are blood tests, they showed 30% to 40% of tested populations had COVID antibodies, and that was pre-Delta. So that number is certainly much higher now. So it's important to think about, we're making this transition from pandemic to endemic, and as that occurs, what are the reliable indicators of the impact? And counting cases becomes less reliable. And we really need to focus on those impact events, which are the hospitalizations and deaths. And those do continue to be occurring mostly in unvaccinated people. There will be breakthrough cases in fully vaccinated people in highly vaccinated communities. Even the most effective vaccines aren't 100% effective. So, what we end up seeing is that even though cases may rise in highly vaccinated communities, the hospitalizations and deaths really don't. Whereas when cases rise in unvaccinated communities, you do see that the hospitalizations and deaths do tend to rise more. In Virginia, of the over 5,400,000 fully vaccinated individuals, 1% have developed COVID. Just about 56,780. 0.037% have been hospitalized, 1,996, and 0.013% or 708 have died. And of those folks that end up hospitalized in the intensive care unit on the ventilator or dying, they do tend to have other medical conditions, and they do tend to be older overall. So, again, the vaccines are very effective in what they are meant to do from a public health standpoint. So what does this mean for families and individuals? As we make this transition and move to endemic, the personal risk assessment is essential, not unlike risk assessments we do every single day. We still do have substantial or high transmission throughout the New River Health District, throughout the state and much of the country. Our areas to the south that really had those significant Delta surges are down into the moderate, and even some of those are in the low range. COVID-19 is still very dangerous for older, medically vulnerable, and unvaccinated people. And even vaccinated, healthy people can get ill and die from COVID. That's the unfortunate thing about infectious diseases. Every person and family has to evaluate how much risk they can and are willing to take. We still recommend all of the non-pharmaceutical interventions: washing hands, wearing masks, especially indoors in poorly ventilated spaces, when with people from outside the household, certainly with unvaccinated people. Avoid close contact, crowded spaces, confined spaces, try to be outside as much as possible. And of course, we still ask everyone who has any kind of respiratory symptoms, cough, stuffy nose, runny nose, fever, unexplained headache, to go ahead and get tested. Get tested for COVID, get tested for flu, and stay home from work or school, stay home from any gatherings. We continue to encourage vaccination. Getting more people vaccinated will definitely help. Get vaccinated against flu and COVID. You can get vaccinated at the same time. Infection from the illness does give immunity, but when we have a safe, effective vaccine, public health is always going to advocate for vaccination over infection. And part of that is, the longer term risks of infection itself are much less predictable. Full immunity starts about 2 weeks after that second shot or after the COVID shot. We tend to hear people say that they're not going to bother to get vaccinated since they don't have 2 weeks before Thanksgiving or an upcoming gathering or event. And we would say, go ahead and get vaccinated anyway. The shots do start working to build that immunity. So even if you're not at full immunity, you will start having some immunity and build protection against getting COVID vaccine or COVID or the flu, and then from spreading it to others. So we encourage everyone today, tomorrow, go ahead and get vaccinated. As far as our vaccination progress, I think everyone probably knows last Friday, the CDC, after the FDA recommended COVID booster shots for all adults 18 or older. That's the bulk of the vaccines we're giving right now. And their language is such that they say that those who are 50 or older and those in high risk occupational settings should get vaccinated. Those who are 18 or older may get vaccinated. So we are definitely giving a lot of booster shots. Between 30 and 40% of our most vulnerable populations have received their booster doses. And our demand for the 5 to 11-year-olds has somewhat leveled off after a significant surge in the beginning once the 5 to 11-year-old vaccine was authorized. So far, we've vaccinated 1,483 children in the 5 to 11-year-old range with at least one dose. Those who are vaccinated would only be eligible to start getting second doses tomorrow, but that's about 12.8% of that group. Our older children have had the opportunity to get vaccinated since May, and 43% of our 12 to 15-year-olds are fully vaccinated, and 49% of our 16 to 17-year-olds are fully vaccinated. So this week, as we celebrate Thanksgiving, we want everyone to have a peaceful, safe holiday. Take time to regroup, and spend a little time just reflecting, unwinding, rejuvenating. It's been certainly a long 2 years. Those who are unvaccinated, please get tested before traveling and gathering for Thanksgiving. If you can, get vaccinated. Anyone who feels sick or has been in close contact with someone else who's tested positive obviously shouldn't be around others. And again, it comes back to that risk assessment. If you're gathering with a multi-generational group at Thanksgiving, obviously you have to be more careful and take care of those who are on the older side and those who are on the very young side, especially using masking and distancing, regardless of vaccination status. And certainly if you're around anyone who's not vaccinated, masking and distancing. If the weather's too cold to gather outdoors, even indoors, can open doors, can open windows, try to be in bigger open spaces as opposed to kind of more confined closed spaces. Even the kitchen and bathroom fans help with the ventilation. And then obviously we talk about washing hands. This Thanksgiving, we do have a lot to be thankful for. Since last year, we have vaccines in abundant supply, and they are highly effective. We also have treatments, monoclonal antibodies, which are very effective in preventing hospitalization and death. And there are 2 new oral medications, which we do expect to be authorized in the coming weeks as well, that are also very effective in preventing hospitalization and death. So it really kind of expands our toolbox and what we have as we continue to deal with COVID-19. We have tireless workers in public health and many other fields who have enabled us to come this far and have kept going through these months of uncertainty. Again, I'll reiterate, we do expect a rise in COVID cases, and we also expect that we will be seeing more flu cases after our holidays. So this is something we've got to do our best to prevent, use all the tools that we can, use what we know works, and learn to live with and learn to live with the infections. I think one of the most telling quotes that I read in an article this week as I was going through things was that virus is gonna virus, meaning that this is what they do. Viruses are going to infect people, and they're going to replicate, and they're going to spread. And unfortunately, we can't suppress them forever, and we can't make them go away. They will be around, and we have to learn to live with them and do our best to protect ourselves and protect each other. So I think that's all I have, and then I'll take questions.
Thank you for that. It doesn't appear that we have any questions at this time. So we'll give everyone just another minute or 2 here, or I should say a few seconds. Minute or 2 could feel like an eternity, huh? We do appreciate you taking the time this holiday week, to meet with us, and we look forward to the next time. So far, again, I see no questions, so I think we're done for today. Thank you.
Thank you all. Everyone enjoy your Thanksgiving. Safe travels if anyone's traveling, and safe gathering if people are gathering. Thanks so much, Jen.
Thank you. We'll talk to you next time. Take care.
Bye-bye.